So let's talk about the differential diagnosis. So first would be fissure. Ask patient if the patient is having a constipation and having pain during passage of the stool and a streak of the blood over the first part of the stool, so it would be a fissure. So first differential would be fissure. Start from the benign things and then continue over to the carcinoma. Second would be hemorrhoids. Ask about the something coming out of the anus and with splashing of the blood after passage of the stool, so it's very important. Then third differential would be diverticulosis. So if a patient comes to you with diverticulosis, he or she might have a problem with the constipation and bleeding per rectum for a long time, and the patient usually is elderly patient. And if a patient comes to you with complaint of the abdominal pain with fever and bleeding PR and your abdominal pain, so it could be diverticulitis. So it's this one is an inflammatory condition. Then ask about the inflammatory bowel disease. Okay. If the patient is complaining of the lower abdominal pain and mucoid diarrhea with blood in the diarrhea and prolonged history of the steroid use and with joint pain and difficulty in seeing like a blurring of the vision, so it would ask about the ulcerative colitis and Crohn's. Okay, the fifth differential would be obstructive symptoms, like the patient had any history of the obstructive symptom, like have had abdominal pain and with constipation, nausea, vomiting, and admitted to the hospital with abdominal distension. So this thing is also very important. So ask about the obstruction. Right-sided lump history with anemia. So this history is very common for the right-sided colon cancer. Sixth differential would be carcinoid. With loose stools, does the patient having flushing of the face after ingestion of the food? So it's very important. Then ask about the seventh differential would be amoebooma. Patient had a history of the traveling to the foreign country and then came with the low abdominal pain and diarrhea, so it could be amoebooma, and patient already had the antibiotic for this purpose, but it doesn't resolve. Our A differential would be endometriosis. The patient should be female, and ask about the bleeding per rectum along with the masturbation, so it's very important. And 9 differential would be synchronous CA carcinoma, like for the left sided CA patient came with the weight loss and obstructive symptom. So these are the differential diagnoses. So our 10 differential could be tuberculosis if a patient is from underdeveloped country. So tuberculosis is very prevalent in the third world countries. So patient presents with the night sweats and evening fever, vomiting and abdominal distension with constipation and vomiting. So it presents with a subacute obstruction. So these are the questions related to the tuberculosis.